A real basic standpoint, if you can see this picture over here, our knee joint's basically made up of essentially three bones. You have the femur bone, the patella or the kneecap, and then the tibia bone. These bones are covered by what's called hyaline cartilage, which in this picture is represented by this pink tissue that's covering the bone. There's really four main ligaments of the knee: the outer ligament, the inner ligament called the collateral ligaments, and then you have your ACL and the PCL, which are the ligaments inside the knee that you hear about, injured during football or basketball, that we take care of as well. And then you have the tendons that aren't represented in this image that hold the kneecap down here to the tibia that allow you to move your knee. As we get onto looking at an arthritic knee, what is the cause of this? Well, arthritis is a real cause of joint pain, especially knee and hip pain, and we see a lot of knee and hip arthritis and a lot of folks that need treatment for it. And really the most common cause of knee pain is osteoarthritis, which is the most common type of arthritic changes of the knee. You also see rheumatoid arthritis and then a post-traumatic arthritis, meaning someone that had a bad accident at some time that may have broke either the end of the femur bone or the tibia bone that was fixed or maybe not fixed by an orthopedic surgeon at some point, can go on to get arthritis as well. But this picture down here, and again, sorry for some of you may not be able to see it, I'll have some more pictures in a second. What happens with osteoarthritis is that the covering of the bone starts to wear down. And I tell most of my patients, I equate it to the tire tread of your tires. So, as you get up to 5,000, 10,000 miles on those tires on your car, that tire starts to wear down, that tire tread thins. Just like the lining of the knee, that lining of the knee starts to thin as you walk on it throughout your life, and it gets just regular wear and tear of the cartilage. So again, here's a real normal looking knee with your femur bone, the patella, the tibia. The small bone over here on the side is called the fibula. It's involved in where ligaments attached to it, but it doesn't make up any articulation, meaning you don't walk on the fibula bone. And then in this picture, for instance, the cartilage is represented by the white covering of the bone. Well, again, a good schematic of arthritic knee is what happens is that white covering of the bone starts to wear out and you start getting down to where the bone is exposed. And we talk about degree of arthritis, and a lot of times when you come to an orthopedic office, you get x-rays, and that'll show us how much arthritis is in someone's knee. If you look at a normal knee on the left side, the picture on the left, you can see down here these nice spaces that are between the two bones. That space represents the covering on the bone, the cartilage. We can't see cartilage on x-rays, we only see the bone. But we know that it's there because this patient, for instance, has this space. As opposed to an arthritic knee that you look at on the right side here, as you look here, there's no space between this is the inside of the knee, there's no space left there. And so that patient has worn out that cartilage, and when you get an x-ray of it, it shows that they're down to bone-on-bone arthritis. And you may have had friends, or you yourselves might have been diagnosed with arthritis before and been told that you had bone-on-bone arthritis, and it's just that. You look at the x-ray, it's down to bone-on-bone. And there's varying degrees of arthritis. This would be a pretty severe case where it is down to bone on bone, but you can see as time, as you watch x-rays over time, it'll start to show that this space can thin, and eventually when it gets down to bone on bone arthritis, we're talking about possibly knee replacement. Again, this patient here on the picture on the right would be someone that would be a good candidate for a knee replacement, and it's real common to see the inside of the knee wear out the soonest, and that's because the majority of us, because of our anatomy, we carry most of our weight on the inside portion of the knee as opposed to the outside portion. Sometimes both sides wear out, but it's probably the most common knees that I see are worn out mostly on the inside to start with, and then eventually the outside starts to wear down.